The October 23rd, 2018 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mrs. Conley. Mrs. Draw. Ms. Harris is excused. Mr. Lightfoot. Mr. Michike. Mr. Moyo. Ms. Taylor. Mr. Wilt. Chairman Zale.
I am here.
President Carbone.
Let's see. Is there anyone signed up for the public forum?
There is not.
Is there anyone present who has not signed up to speak who would like to address the committee at this time? Seeing none, the next item on the agenda is approval of the minutes. You have the September 17, 2018 minutes before you. They stand approved unless the clerk is notified by any changes by the end of the day. Next item on the agenda is new business. Mr. Clerk.
Referral 18-0285.
Moved by Legislator Taylor, seconded by Legislator Conley. Is there any discussion on this item? Legislator Moyo.
Thank you, Mr. Chairman. I apologize if this was asked in IGR. I walked in 2 minutes late, but through the chairman to the administration, why is this only dealing with the city and with Greece? Was it made available to other school districts in the county?
Through the chair, through the previous 6 years of this effort, collaboration with the University of Rochester, when it was done in collaboration with their process, all of the other school districts were involved at some level. This year, as we continue with the process, we continued with the 2 school districts who were enrolled with us last year and wish to extend and continue this year, and that is our capacity.
Okay, thank you. So it sounds like both the other school districts have either opted out or are being pushed out because of funding concerns through the chair?
Through the chair, these were the 2 districts we had last year, and we are continuing exactly as we were last year.
Okay.
Any other discussion on this item? Seeing none, all those in favor signify by saying aye.
Aye.
Any opposed? Item carries. Next item, please.
Referral 18-0288.
Moved by Legislator Conley, seconded by President Carbone. Is there any discussion on this item? Seeing none, all those in favor signify by saying aye.
Aye.
Any opposed? Item carries. Next item, please.
Referral 18-0289.
Moved by President Carbone, seconded by Legislator Wilt. Is there any discussion on this item? Legislator Conley.
Thank you. Mr. Chair, through the chair to the administration, has Monroe County ever participated in any other jail diversion program similar to this one?
Legislator, could you please repeat the question?
Certainly, Mr. Chair, through you to the administration, has Monroe County ever participated in any other jail diversion program similar to this one?
Through the chair, we've participated in initiatives that relate to jail diversion, but nothing that was provided for in terms of a New York State Office of Mental Health grant. We've had past SAMHSA grants, one of which several years ago focused on women who were frequently incarcerated, yes.
Thank you. And through the chair, could you give a brief description of this particular program?
Through the chair, yes, I'd be glad to. This program is intended to create a jail diversion law enforcement drop-off center, which would be fully staffed, starting out with limited hours, but eventually expanding to 24/7 operation. We would be looking at the lowest level of chargeable offenses, looking at violations and lowest level misdemeanors, particulars of that, yet to be worked out with law enforcement, DA, public defender, et cetera. Law enforcement is very enthusiastic about this. These are individuals with significant mental health conditions who frequently end up at hospital emergency rooms and or jail, and we're looking for more creative solutions to connect people to the services that they need.
Thank you. And through the chair, would the drop-off center be a physical location?
Through the chair, yes, it would be a physical location. We currently have a request for proposals out, which we answered Q&A, which is posted on the county purchasing website. And those responses are due back by the end of next week. And I apologize, the end of this week. and then a determination will be made through a selection committee of an appropriate vendor.
Thank you. So through the chair, the location is yet to be determined?
Through the chair, that's correct. It would all be dependent on which respondent successfully replied to the request for proposals, but they would be responsible for enhancing an existing location or creating a new one.
Thank you. And through the chair, how many people do we anticipate would be served by this program?
Through the chair, we don't know exact numbers, but given that there are over 4,000 folks brought to hospitals under mental hygiene status and hundreds brought to jail who probably could benefit from some other service, we're estimating in the first year several hundred, at least 300 to 500, but we'll have to determine that as time goes along and be happy to report that back here as it develops.
Thank you. And through the chair, what services will be put in place that at the time that the person is dropped off at the center?
Through the chair, thanks for your question. First of all, law enforcement would have the opportunity to not charge with an offense, or they could provide an appearance ticket so that the person is still accountable to a court for the alleged offense. When they would arrive at this center, they would be screened for mental health and substance use related issues. They would be provided some treatment, crisis intervention, connected to an outpatient provider, or if it's determined that they actually need an inpatient admission, they could be referred for that. As you may know, our preferred site for folks with primary substance use is the Open Access Center at 1350 University Avenue. However, many people with significant mental health conditions simultaneously deal with or suffer with significant substance use disorders. 60 to 70% do as well. So we would want to connect them with those crisis services. It could be a day intensive program such as a partial hospitalization. It definitely should include some sort of case or care management to make sure that the person is not lost to contact, but engaged in treatment and then be able to show evidence of stabilization over time.
Thank you. And Mr. Chair, if I may, one last question. Has there been any consideration for cases that may include domestic violence and the need for orders of protection to be issued?
Through the chair, that's not a specific part of this grant. However, we would anticipate that the provider would be connected to social service supports, other human services supports, so that would definitely need to be a part of what goes on, but we haven't planned specifically for that, and I thank you for your question. That's a good consideration.
Thank you, Mr. Chair. I would just ask the administration to consider that if someone is being arrested for an act of domestic violence, that the victim in that crime would not be able to get an order of protection if the charges weren't filed, unless the victim went to family court the next day. So just ask that that be a consideration in designing the program and responding to domestic violence in the community.
Thank you, Legislator.
Thank you.
Is there any other discussion on this item? Legislator Lightfoot.
Thank you so much. Through you, Mr. Chairman, to the my colleague across the aisle, those are very good questions. I know that because I had some of the same. All right, great. I just want to, through you, Mr. Chairman, to the administration, thank the administration for all your fine work on mental health and this new program. We think that it'll be excellent, and we know that our Sheriff's Department has been asking in dire need for an alternative. Through you, Mr. Chairman, to the administration, is this the first year of the grant, or just the first year we are receiving it?
Through the chair, this is the first year for this particular funding stream. These are federal block grants to the New York State Office of Mental Health. It is expected that the funding will be expended by the end of next calendar year, 2019. Although there's no guarantee of continued funding, there would be a hope that potentially there could be, and that actually in the future we could do some further innovative initiatives, primarily because what we would expect a provider to do is also be able to bill for certain amounts of these services, which then would protect some of the funding, which then could potentially be rolled over into other potential initiatives.
Thank you. Thank you so much.
Any other discussion on this topic? Seeing none. All those in favor signify by saying aye. Any opposed? Item carries. Next item, please.
Referral 18-0290.
Moved by President Carbone, seconded by, I'm looking for a second. Seconded by Legislator, thank you. Seconded by Legislator Wilt and Legislator Lightfoot. Thank you. Any discussion on this item? Legislator Conley.
Mr. Chairman, just wanted to, first of all, ask if we had updated figures on how many minors were served by this program so far in 2018.
Thank you, legislators. Through the chair, we have 143 unduplicated youth being helped so far through 2018.
Thank you. And through the chair, it seems like this funding has represented a dramatic decrease from the time that I've been in the legislature. I think my first year as a legislator, the funding was close to $125,000 a year. So I guess my question is, since there has been a significant decrease in funding, but we continue to be so successful in reaching out and making a difference in these minors' lives, is this program at risk?
I think through the chair, I think any program funded by New York State is always at risk, especially anything to help our youth. They seem to receive the quickest cuts, unfortunately. But since the inception of the program, you are correct, we had $124,000 in the first year. This year, we went up to $114,000 if accepting this amendment tonight. And at the full legislature coming up. New York State provided us with $25,000 in state funding, and Office of Mental Health basically saved the day with $75,000 this year. The state sees us as what they call a graduate community because we were one of the first 5 pilot programs, and we do the best job, quite frankly, in New York State. And they come to us asking for presentations, for help with the new counties that are getting off the ground, and some can't even do that. And that's why we're receiving this $14,000 addition, because other counties couldn't do it and said, we can't accept the funding. And fortunately enough for us, New York State comes and says, hey, we have this extra funding.
Thank you. And Mr. Chair, I just want to express that this program is very effective, and I'm aware of 2 children who actually were able to testify in federal court and made a significant difference. This program made a significant difference in their life. And children who have been sexually trafficked, the kids who actually do come out on the other side are usually the kids who have been helped by this program at Center for Youth, and I'm very grateful that we're continuing to fund it, and I want to thank Mr. Berry specifically for continuing to fight for funding for this program.
Through the chair, thank you very much, legislator.
And if I may, I'd like to echo that sentiment. Thank you for everything you do for these youth. Obviously, that's a big part of what I feel is my commission as well. I'm wondering if maybe you can elaborate a little bit on this program and tell us some of the things that are just so excellent about what it is that you guys do.
Sure. Through the chair, it's a great thing for a bad situation. These are youth that have been trafficked. When we began the program, we wanted to make a dent by saving as many runaway homeless youth as possible because they were the most preyed upon. The year before we began this, we had around 30-something, I want to say 36, I could be wrong, 33 or 36 youth in New York State that were red flagged as sex trafficked victims. In that first year alone, when Monroe County came in 2013, we had 23 found. In 2014, we found 72. In 2015, we found 209. All said and done, we are at 927 youth in Monroe County alone. It's not because Monroe County has a bigger problem or it's more prevalent. It's because we do the best job finding our victims. Other counties throughout the state have a difficult time. We have a great partner in Center for Youth. Quite frankly, without them, we do not have as great a turnout of people being advocates, people finding these youth. We partnered with them because they do such a great job with the runaway homeless youth. They were able to find those youth quicker and be able to flag these, we call them red flags, anything that would say, oh my gosh, this could be someone that's being trafficked. Let's see if we can help get them the resources. And those resources can be anything from physical help, emotional, spiritual, new clothes, finding a place to stay at a moment's notice. That's what these dollars go to. And if I might say, with government funding, you know, $100,000 some odd dollars really isn't a lot of money. But with those $100,000, we've made the biggest hit possible. And again, you know, we have a great partner with Center for Youth that helped make that happen.
It's excellent. Thank you. Is there any other discussion on this item? Okay, then. All those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item, please.
Referral 18-0291, acceptance of a grant.
Moved by Legislator Wilt, second by Legislator Taylor. Any discussion on this item? Seeing none. All those in favor signify by saying aye. Aye. Any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the October 23rd, 2018 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held Tuesday, November 27th, 2018 at 5:30 p.m. Thank you very much.